I spoke a lot about the complications of liposuction. Now we'll come how to avoid this complication and how to recover faster. That's what really important. See, if you a lot of the fellowship people come to me for training for the all the cosmetic surgical procedures. What I say to them is the surgical part is only 50% of the final results. How you perform. That's almost same all over the world. The major difference is the post-operative advisors and post-operative follow-up and post-operative medications. All those things matter to give a 100% good results. See, what I'm going to say is my experience, what I am following to make the results faster. So I hope this is going to be useful to a lot of plastic surgeons across the world. So the first thing is, most of the complication happen because of the abnormal inflammation inside. So why it is happening? We are closing the ports. Say example, we make two small holes in the tummy below the undergarments and we suck out the fat. Sometimes arms we make a small hole here or sometimes around the armpit. All 5 mm holes. What normally most of the plastic surgeons we do, even I do earlier days, is we close the wound. We don't want the fluid to come out and stain the garments and stain the plasters. We close the wound. Because of that, what happens? The fluid stays inside. Because fluid is staying inside, the inflammatory mediators and inflammatory process is so high, because of the swelling will be so much, the pigmentation will be so much, the erythema redness will be so much, and recovery will be delayed a lot. So make the patient understand the issues of leaving the wound open. What happens if the leave wound open, first 3-4 days, sometimes even 5-6 days, the fluid keep coming out. If the area is big, fluid keep coming even for 10 days. But when it comes out, your recovery will be faster, your results are faster, your complications are less. So you are reducing the inflammation in the body. So leaving the wound open is one of the simple way to avoid the complications and the faster recovery. Second thing, as I explained earlier, proper pressure garment. If improper pressure garments lead on to a lot of complications, give a proper pressure garment. The patient has to monitor it, the doctor has to monitor it. With the proper discussion between patient and doctor, sometimes it has to be altered in a proper way so that the patient gets a good result. Third thing, the medications. Usually we put painkillers, antibiotic, and those things are very common. So that is routine for the healing. We want to avoid the infection and want to make you pain-free. Because of that, we give those things. Along with that, few things are really useful. One is the vitamin C. See, as I explain all the complication, most of the time we keep saying that word inflammation. To reduce the inflammation in the body, in fact, if I am planning for a major liposuction, where I start the patient on vitamin C even 10 days prior to the surgery, high dose of vitamin C, even I go sometimes 2 grams or 3 grams per day also, depending on the surgical stress and surgical process. So starting the vitamin C even 10 days prior to the surgery and continuing it for a month after surgery is really a useful tool for the faster healing and reducing the complications. Second thing is the skin tightening effect. The skin tightening, because the garment skin get tightened, even the liposuction cannulas, when it goes under the skin, a lot of tunnels are created. Because of the tunnels, the skin will tighten and fibrose and get tightened very well after the surgery. But along with that, if you add collagen peptide powders, usually it comes in a sachet, you have to mix it in water and drink every day, 1 or 2. So that really helps in skin tightening. So initially I thought, okay, it might be placebo. That collagen peptide powder has a non-vegetarian source. Some fish powders they are mixing to make it stabilized. So some vegetarian patients won't take the collagen peptide powders. I can see definitely a lot of difference between the patient who take the collagen peptide, who is not taking the collagen peptide, and results are definitely different. Skin tightening is little lesser than the patient taking the collagen peptide powders. Not only the area where we are doing liposuction get tightened, all over the body it acts. Even patient comes and says, sometimes even my face looks better, my face looks younger, and this kind of comments will come. So collagen peptide powders are really a useful tool after surgery. Same way, arnica. This is a homeopathy medicine prescribed all over the world by the plastic surgeons. Usually we refer the patient to the homeopathy doctor and make them get the homeopathy medicine even prior to the surgery. Even 3 days prior to the surgery, they put them on homeopathy medicine and they have to continue for a week after surgery. That also reduces the swelling a lot. So I have given a lot of information about liposuction here. So each doctor's approach is different, and so this is my approach. So each doctor has their own experience and they have done a lot of cases. They'll have a lot of experience in each cases. So follow your doctor's advice properly, and definitely you get good results. But only people who need liposuction has to go to liposuction. I am obese, I want to become thin, is the people definitely not to go for a liposuction. They are not ideal candidate for liposuction at all. Only resistant fat, and where there is a lot of fat accumulated, not going down by diet and exercise, only those areas are ideal for liposuction.